Joining me now is Dr. Scott Koppel with Family Podiatry and Vein Care. Thanks for joining us.
Thank you for having me.
Now, first off, a lot of Americans are seeing a problem with venous reflux disease. Explain to me what that is.
Well, simply when you walk or move, you have valves in your legs that allow for one-way flow of blood upwards through the leg veins. And people with venous reflux have damage to the valves, so blood leaks back down through their legs. And when the blood pools in the lower legs, you can have symptoms ranging from pain, heaviness and fatigue in the legs, bulging varicosities, and even you can develop what's called a venous ulcer, where the tissue can break down to an open sore or wound.
So who is more likely to get this?
Well, anyone in the population can get it, but we tend to see it more in people like teachers or hairdressers or nurses, people with standing occupations. Certainly women we're going to see more than men because you typically will see this in people with multiple pregnancies or even the heavier set population, unfortunately.
So what are the symptoms you can see? I know I've heard of the term spider veins.
Spider veins would be just the start of the disease process, but it can slowly progress to people having bulging varicosities or painful leg swelling, or a lot of people actually, when you ask them, they don't really complain of pain. They just say, my legs hurt, they feel tired, they feel achy. And they think it's normal to have that problem, but really it's not.
So if you're feeling these pains in your legs, what's the best options?
Well, you can start with wearing support hose, but a lot of my population comes in and nobody really loves putting the stockings on. It's Gainesville, it's hot. It's hard to get the stockings on their legs. So when you're not happy with using something like that, you may consider coming in for treatment. And treatment typically would consist of an evaluation with an ultrasound and moving forward with a procedure called an ablation. That's where we would seal or close off the leaking vein, and that improves the blood flow through the veins that are working for better return to the heart and lungs.
So what advice do you have to give to any men or women who think that they have this disease?
Well, if you think you have a problem and you're having symptoms, the best thing to do is have an evaluation. You know, see your health professionals, come in for an ultrasound, and that can tell us really which veins are problematic, if the veins are problematic, and talk about moving forward with some sort of treatment.
Well, thank you so much for joining us.
Thank you.
And coming up after the break, meteorologist Mike Potter will have your weather forecast. This is your only local news at noon. Stay with us.